Welcome to week 1 of the massive online open course on gender and mining governance. My name is Laura Grassi. I work for Source International, a non-governmental organization that works with the community affected by environmental pollution and health impact caused by extractive industries. In Lesson 1 we gain an overview of a wide range of gender impact on local communities. We also learn how women and men are differentiatedly impacted by mining operation, and we also understood how girls and women are exposed to some toxic chemicals that pollute air, water, soil and food. Linked with mining operation. So now I'd like in this lecture to show you two interesting cases in Indian mines that show this differentiated impact. So first of all, I show you the Indian uranium mine. The mine is owned by the Indian company. It started to mine in 1967 in the village of Jaduguda. During the dry season, the mining dust blows into the surrounding villages, and during the monsoons, the wastewater spills into creeks and rivers. And the many accidents happened during and across the years, and thousands of liters of radioactive wastewater spills into the environment. People was not aware about the hazard, the important and extremely severe health hazard due to the exposure to radioactivity. And it was no longer until people start to develop some diseases, and the most important target of these diseases were women. Many studies show how 37% of women reported some kind of disruption in their menstrual cycle, 30% report some infertility problem, and 18% report some miscarriage and stillbirth. Furthermore, because of exposure to radioactivity of these women, the congenital children malformation rate at birth was very high, 6 times higher in a village close to mine compared to those far from the mine. So the mining company always denied their responsibility of this impact. The government did not address the concern of those people, and fortunately the Indian Federation of Trade Union, together with some local, national and international organizations, began to support those affected community, training them on ways to how to prevent their exposure to radioactivity. Another important civil organization, the JOAR, began to promote some earth survey, legal action, awareness activity, medical care training for women, and they began also to open a dialogue with the mining company, asking them to provide indemnification, employment and housing for affected community, but unfortunately without a fully keeping agreement by the mining company. The second case is always in India, but this time is about a mica mine. Mica is a mineral that is used in mobile industry, electronics and cosmetic industry. 60% of mica is extracted in India and 70% is illegally mined. This type of industry is economically unfeasible for many countries because of the manual labor. So India, because of its low labor cost, it attracts many businessmen in this sector, and Children and women represent the most important forced labor. They are poor, they are illiterate, and they are landless. 20,000 children approximately are involved in Mica mine. They work in Mica mine, in the main two important regions in India, where the 37% of the population is below the poverty line. Many occupational hazards reported in children include head injuries, cuts, abrasion, and between 10 to 50 children died every month in India because of Mica mine collapse and accident. Many studies reported that women because are exposed to some toxic chemical, they began to develop some respiratory diseases like silicosis, bronchitis, asthma, and also arthritis. Fortunately, in the last couple of years, many pressure have been made on this mining company, on this mining sector, and in the first responsible Mica initiative was established in 2017 with the main aim to eradicate child labor by 2022, to promote better working conditions for women and to protect environment. The government also is working to legalize and regulate Mica mines. It also trying to create some child-friendly village with the aim to promote education and to fight and block the cycle of child labor. And many NGOs are working to provide medical care to women and to provide and to create and promote some alternative livelihood such as farming, fishing, livestock for women in affected communities. So now I'd like to leave you with a couple of recommendations because you as representative of government, of civil society and a mining company can follow to protect women in mining context. If you are representative of the government, you have the obligation to protect women in mining sector. You have to enforce law about children protection and labor law in order to eradicate as soon as possible the child labor, and you have also to promote alternative livelihood and to reduce the negative impact on human rights. As you can see in the previous case study I showed you before, the government has an important role in change law and enforce law in order to protect human rights. If you are representative of mining company, you can, for example, conduct an health impact assessment with gender focus. You have to include women during the community engagement and consultation process in order to guarantee a gender balance. And also you have to be engaged in social empowerment program that address the root causes child labor, which has proven to carry devastating social costs as demonstrated in the Mica mines case. And if you are civil society representative, you have the possibility, you have the opportunity and the power to raise awareness on the importance to eradicate child labor, as shown in the case of Mica mine. And you also can, for example, conduct some independent research and study on women health impact by mining activity, and be vigilant on women health impact by mining activity. So that's all. Thank you so much for watching, and good luck for your important work.